So the next aspect we're going to be looking at is flexibility. Now flexibility is one that is pretty well known to be very helpful for stroke victims. A lot of the functions that it can help is increase the range of motion at an area. It can help reduce any muscle spasticity in the area. And it can generally improve motor function of the area. Once again, the flexibility you're going to want to do on both sides, just to make sure you don't have any problems where one side becomes slightly altered than the other. But at the same time, the main focus of the stretch is going to be on the affected side of the stroke, because that's the area where they're going to be struggling with flexibility the most. So this one has modifications in which how much assistance they need during it. So the most basic one is they're going to try bring their knee up, their ankle, sorry, up to their knee. They're then going to put one hand on their knee and the other hand on top of it. The hand that goes on top is going to be the unaffected hand, so the unaffected side, so they're able to produce more force. If they are struggling with this, so like the easiest type of one, that's going to be where the supervisor is going to need to help them get the knee up, and they're also going to need to help them provide more force. Now the safety cue with this stretch, of course, is only going to the stretching distance that they're comfortable with. You don't want to cause any overextension in an area, you don't want to cause any damage. So as soon as they feel they're at a comfortable range, then that's when you can stop the stretch. So the next one is the exact same thing, but they can do it completely independently. So they're able to get the foot up, they're able to also produce as much force as required as needed to actually get it down. And then the final variation would be you'd have some kind of dumbbell, kettlebell, or some kind of weight. You'd want it very light, probably no more than 5 to 10 pounds, depending on the person's problems. And they would then do the exact same stretch again. They'd be assisted with a weight, where they would then hold the weight on top of the area. And this one, once again, the safety cue here is going to be making sure they have a stability of the weight and you're at a distance where you can make sure there's no problems. But that extra weight is just going to increase that hip, external hip rotation. It's going to help loosen up their hips, and it should improve their gait when they're walking, especially on the affected side that can cause a lot of problems with reducing the gait as they walk. So just loosening that up, getting everything opened up can improve their ability to walk in pretty much everyday tasks. Okay, so the next flexibility exercise is going to be focusing on the thumb. Now, it's quite a rare exercise for someone who's not a stroke victim. However, in this case, when they are, one of the main problems is after a stroke, especially if you have quite a severe one, on the affected side, they can have quite a lot of muscle spasticity in the affected hand. And as a consequence, they struggle grasping things and picking things up, and it becomes quite a problem for everyday life. So what we're trying to do here is extend the range of motion between like the index finger and the thumb, gain more control of it, and basically improve its general range of motion. So therefore they have more strength and more flexibility to actually grasp things and help them going forward. So once again with stretching, the only real safety cue here is just making sure that you stretch them to a comfortable distance. You don't overextend it and cause any damage that's unnecessary. So once again here, the three different options is going to be the easiest one, is especially if it's on the affected hand or the unaffected hand. As the therapist, I'm going to help push the thumb back to a range of motion whenever they feel comfortable. I'm then going to sustain this stretch for 30 seconds. You're then going to release. You're going to give them 30 seconds to recover from the situation, and then you're going to do it again. You're going to do 4 sets of this for 30 seconds. Now, the moderate one is someone who has slightly better coordination and a grasp over their hands. They're basically going to do it themselves. They're going to use either the affected or unaffected hand to do it onto the other one. They're going to pull this thumb to a range of motion that's comfortable for them, and they're going to sustain the stretch for 30 seconds again. Once again, 4 sets of this. And then the final one is you're going to need some kind of external object like a wall or a barrier, or in this case a chair. This is going to combine a mixture of static stretching and ballistic stretching. So what effectively they're going to do is they're going to use the edge of the chair to do 10 pumps, where they're able to bring the range of motion of the thumb past what they would usually be able to hold. So therefore they're going to stretch this 10 times, and then on the 10th one, they then find a range of motion that's comfortable. They sustain that hold for 30 seconds. They repeat that 4 times, and then that's the exercise done.
Just like the warm-up, cool down plays a really essential part in the exercise program. Typically, you will see a mixture of some sort of like a brisk walking or something, or stretching, and so that the stretching really helps the patient maintain a good range of motion. The benefits for a cool down are body restoration, heart regulation, and injury prevention. And I'll go through a couple of examples of a cool down that we could do with older adults that have suffered through a stroke. So for the first one, we'll just have them do a little upper body stretching, and this could be anything to where they'll take one of their arm and stretch it across their body like this, and they'll do the same thing with the other arm. And you can do take the arm just like this and pull it behind their head. And just these stretches will help really help maintain their range of motion. And for the second one, we'll have them a really good cool down as a child's pose. So for the first child's pose, we can have them do, if they can get on the floor and do the actual child's pose like this, that's really recommended because it really helps. But in case they can't get on the floor and they have some complications, they can do it in a chair just like this and lean forward and do their best to stretch that lower back and that gluteus maximus. And so for the another one they can do is a brisk walk, just like the warm-up. They can, after they're done working out, they can walk at their own pace just to cool down and get everything back down to a nice steady state. And so for another final one that's a good one they can do is a leg stretch, single leg to the knee, chest like this, and they'll pull up their knee up like that. And if they can't do it standing, they can either do it in a chair or lying down. And cool downs typically last about 3 to 5 minutes.